Please join me in extending a warm welcome to Professor Barbara Maxwell.
Thank you so much for the wonderful hospitality that we've received as Interprofessional Global from the second we arrived in Qatar. So it's just been a wonderful collaborative experience from us as we've stepped into your nation. So thank you. It's my absolute pleasure on behalf of Interprofessional Global to share with you the contents of the Winterthur Doha Declaration and some history about how the Declaration has come to being and, thank you, and what the Declaration is intended to do. You will see we have a QR code on screen so that you can immediately have access to the Declaration because it's intended to be actionable and something that we commit to together. And to do that, we're hoping that you all take a copy of the Declaration to start thinking about how it can be actually implemented in your own setting. It's by doing, by living collaboration, by living the intent is how we make progress. So I'll start by sharing just a little bit about the history of how the Declaration came together and some of the key issues that prompted us to start thinking about a declaration. And it goes back really to the closing of the Altogether Better Health 5 conference in Sydney, Australia in 2010. At that closing, attendees released what was known as the Sydney Interprofessional Declaration. It was a collaborative declaration approved by and issued on behalf of the delegates of the conference, and it articulated their shared commitment to advance and to strengthen the cause of interprofessional collaborative practice and to do so across the globe. The declaration coincided with the publication of the WHO Framework for Action on Interprofessional Education and Collaborative Practice. And it was providing guidance in the form of proposed actions that targeted education, practice, and system policy level changes that were intended to support and advance and strengthen interprofessional education and collaborative practice. So two directions coming together in this beautiful moment. So following the Altogether Better Health 9 conference in Auckland, New Zealand in 2018, members of the Interprofessional Global's Policy Working Group initiated a global analysis to examining progress made in the achievement of those actions and those articles from the Declaration over the 10 years since both had come to fruition. The result, over some significant time and effort, and so we are so absolutely delighted that it is alive as of today. The declaration has been made. It resulted in the Winterthur Doha Interprofessional Declaration, and the declaration reflects on and uses those key findings from that global analysis. The decade following the release of these two really aspirational documents did demonstrate growth in the provision of interprofessional education within healthcare, social care education, in various training programs, and also that had spread across the globe. So we had seen that growth. It was supported by the development and utilization of interprofessional collaborative frameworks, some of which Dr. Gilbert had shared in his presentation. that identified key competencies or capabilities for collaborative practice, so we were learning more about what it was and how to do it. Growing momentum in the development of policy frameworks that support interprofessional education for the future workforce was also evident, exemplified in the inclusion of language requiring interprofessional education in accreditation or regulatory standards for many health and social care professions in many nations. This educational policy shift has been a really notable driver to promulgate the growth of interprofessional education for the next generation of care providers. However, efforts to develop and support interprofessional education for the current workforce have been less evident across the globe, with a widespread lack of system-level policies or processes to support training in interprofessional collaborative practice or team-based care for the current health and social care workforce. There have been beautiful examples of very impactful education within the workplace, particularly from our Canadian colleagues, but across the globe, we identified that this was a missing piece. Many of the advances in interprofessional education and practice have been supported by temporary funding streams, and we're a long way from answering the call for action to establish an environment where the workforce planning, financing, funding, and remuneration are actually supportive of interprofessional education and collaborative practice that was proposed within the WHO framework. So sustainability efforts must be a priority if past efforts and growth in interprofessional education and collaborative practice are to be sustained. And with respect to the WHO framework's proposed actions to advance collaborative practice for improved health outcomes, much work is needed to create the necessary infrastructure to support the integration of collaborative practice models. Governance models that establish teamwork or shared responsibility for health and social care service delivery are evident in some settings, but they are far from the norm. Changes in the built environment, the processes, personnel, funding, care models, delivery models are needed if collaborative practice is to become the new norm. Such changes should be aimed at creating more agile systems that can tackle current and future complex societal challenges. And we've heard a few of our speakers already refer to what happened during the COVID pandemic, when highlighted the importance and impact of teams, trained and effective interprofessional collaboration. During the pandemic, interprofessional collaboration-ready teams responded rapidly to practice and educational adjustments in response to the pandemic, highlighting the capacity of highly effective and adaptable interprofessional teams to support system-wide policy and practice change and to improve the outcomes for individuals and populations. The Winterthur Doha Interprofessional Declaration is intended to build upon the advances and address the gaps in interprofessional education and collaborative practice implementation, evidenced over the last decade, and its articles address policies and actions necessary to sustain the achievements made and to build upon them for the next generation. The Declaration is premised on the following principles. It adopts the WHO framework or definition of health, that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It recognises the significant progress in response to the call for action in 2010, contained within the WHO framework, and the need to advance the work. It commits to shared goals of ensuring access to interprofessional collaborative health and human services to enhance the health and well-being of all. It emphasizes the importance of ensuring that the needs of diverse people and populations are reflected within interprofessional education and collaborative practice programs, and that representation and leadership within each local and national health and human service delivery system supports diversity, equity, and inclusion for health for all. And as we heard in our wonderful introduction from our moderators of the opening, the declaration has been prepared by members of Interprofessional.global, which is a worldwide community of educators and clinicians representing more than 100 countries and 11 regional networks. That is something to celebrate. 100 countries and 11 regional networks coming together to plan the future. So the declaration articulates policies and actions that will build on that momentum from the WHO Declaration. And it's taken place, and the improvements that have taken place over the 12 years at that. We thought it would be 10. We thought it would be here in Qatar 2 years ago. We are here now, so it's 12 years now since they were released. And so we're trying to advance that work, not let it go, move it forward, keep that momentum. And I just wanted to give a moment of attestation and to show you all those who committed their time and work over what has been a 5-year period to get to this wonderful moment when this declaration is live. When it was such a joy to watch that declaration be made official, and especially here in Doha with the formal establishment of the Arabic network. It is just amazing to be here. It makes it a really special occasion for us. So our work began with the policy working group, the members of which you will see listed on screen, who did the initial analysis of that, what is the progress made, sharing best practices, examples, really wonderful stories and exhibits of how interprofessional education or practice is growing differently in different parts of the world, very context specific. And then at Winterthur in 2021, the Global Impact Working Group took up that work again to finalize the declaration, to have the declaration sent to all of our member networks, who then took it to their networks for conversation, and with the hope that the declaration would be supported by those networks. And in the end, the declaration was endorsed by the networks that you see on screen. So across the globe, networks of individuals who come together to support and advance interprofessional and collaboration and interprofessional education for better health for people and populations, endorsed the declaration. So our voice as Interprofessional.global is in behalf of all of these networks. And you'll see the emerging network was how it was endorsed, and the joy of being able to now move that into the Arabic network, into the established regional networks, has even moved since the time that we completed the declaration. So, to the content of the declaration, and this is put to you by the members, the global members of our Interprofessional.global community. You will hear us say we as we talk about the articles. We are hoping that our we becomes this we. Those present here are part of that we in declaring our intent to move forward. So it's through the following articles that the national and regional interprofessional networks that make up Interprofessional.global community, we commit to sustaining and advancing the cause of interprofessional education and collaborative practice across the globe. So our first article, we will advocate for system changes that foster an environment that supports sustainable interprofessional education and collaborative practice and promotes the attainment of the United Nations Sustainable Development Goals. Article 2, we will advance efforts within education and health and social care systems to develop and deliver interprofessional education for all health and social care learners. And the route to do that is by working with accreditation or regulatory agencies to anchor collaborative competencies or capabilities within educational program standards. Advocating for long-term investment in faculty training and development so that we can facilitate the design and delivery of evidence-based interprofessional education and collaborative practice. And advocating for the participation of patients and populations in the design and delivery of interprofessional education. Article 3, we will advocate for policies that transform the health and social care delivery environments to support interprofessional education and collaborative practice, including, and John, you will love this, it's so policy rich, redesign of the built environment to support interagency, intra-agency, and interprofessional collaboration. Establishment of sustainable funding models for facilities and personnel that support interprofessional education and collaborative practice. Investment in lifelong learning in interprofessional education and collaborative practice for the current workforce. Adoption of personnel policies that support collaborative practice and team-based care models. Provision of support to develop and sustain care delivery models necessary for effective interprofessional collaborative practice, and the delivery of person-centred collaborative care and facilitation of collaborative community partnerships to ensure services meet the needs of people and populations. And finally, Article 4, we will work with the World Health Organization, UNESCO, and other international organizations to support the establishment of interprofessional collaboration as the practice norm. So, for those of you who wonder what comes next is a workshop. There will be a workshop today, and the information on the workshop is on screen, where we are hoping that people from all around the globe will come together and plan with us. How do we make this happen? What are the strengths in my region that I can leverage? What are the articles that we can make progress on quickly? Where can we step in to achieving these and enacting the articles within the Declaration? So please join us for that workshop because we want to start now, right now, on making this happen. So thank you.